So short-sightedness, or being short-sighted where you can't see far, or myopia, is a very, very prevalent condition worldwide. In fact, it's estimated by 2050, close to sort of 40 or 50% of the world population will be short-sighted. In some countries like Taiwan or Singapore, close to 70-80% of people are short-sighted. And yes, we have seen an increase in number of young children becoming more and more short-sighted. And I definitely think it's related to lifestyle, with the habit of looking at phones, looking at devices, playing games. It's a lot of kids now spend a lot of time on devices, and it's directly related to myopia. So myopia is a multifactorial problem. So it has many factors that affect or it causes myopia. One of the main factor is near viewing. So if you do a lot of near looking devices, phone, then your chance of becoming short-sighted is very, very high. Yeah, so as one of the ways to manage or control myopia, we always advise to reduce screen time and increase outdoor times to the kids and the parent. But you are absolutely right. It is an increasing problem. We do see that in our practice.
Well, yeah, on top of like lifestyle adjustments and environmental adjustments, I think that there are also some new eyewear technologies that have been released or have become more popular in recent years, aren't there? Like ortho-K is one example, orthokeratology. There are myopia control glasses now that are on the market. But I know that one that is becoming more and more popular in Australia is special contact lenses, soft contact lenses that have like an inbuilt myopia control feature to them. I think MiSight is the brand, isn't it? So could you tell us more about what MiSight lenses are and how they help with myopia?
So short-sighted, or if you are highly short-sighted, then you are at a high risk of having eye health issues. For example, people who are highly short-sighted have an increased risk of glaucoma, an increased risk of retinopathy, for example, retinal detachment. So you will want to try to control your myopia. You don't want to become too short-sighted. So that's what we try to do with our patient. We try to manage or control their myopia, and we do that from a very young age, because it has been shown that it sort of only works well if you're sort of under 18. Not many studies have been done on people over 18, but I guess by that age and onwards, your system, your visual system, and your neural system is all set. So it's very hard to manipulate. So the methods of sort of controlling myopia is first of all, you can wear special spectacle lenses. So it's like your normal pair of glasses, but it's designed very smartly in a way that it slow down the increase of your prescription of your short-sightedness. So they've done a study where they take thousands of people and put them into they're in the age of from 8 to 13, put them into these lenses compared to the same number of children with just sort of standard short-sighted lenses. And over a few years, they find that the children wearing what we call the treatment lenses, the increase in their short-sightedness is 50% less than the other group. So that's special spectacle lenses. What we do a lot in our practice is we combine the wearing of the special treatment lenses with an eye drop. So you can get an eye drop and you use it once a day. It's a very low dose, low concentration, so it doesn't affect your vision. But in the long term, it's been shown to also slow down the increase of myopia. Children who are a little bit older and can handle contact lenses, then we present the option of wearing soft contact lenses to them. It's a soft contact lens, so it's worn from morning till night when you get home from school. So it's called one of the main one on the market at the moment is called MiSight. It's a myopia control design contact lens, and it also has been shown to slow down the increase of myopia by around 50% for the people or the children that wore those lenses. So those are the three treatment options that we have, and we are increasing that sort of treatment in our practice in the last couple of years.
And so the MiSight lenses, you said they are soft lenses. So I know that there are like basically two kinds of lenses. There's the soft lenses and the hard lenses, or what are they called? Rigid gas permeable lenses, which I think a lot of people find that it can be a bit challenging to wear. But with the soft contact, with soft contact lenses, it's just like a soft piece of plastic just fits on your eye, and you don't even notice it. So I guess that's a lot more manageable for a lot of kids, isn't it?
Yes, that's right. I mean, a lot of people out there wear soft contact lenses, adults, for sport and things like that, or people who wear soft color contact lenses. But these soft or the clear soft contact lenses are far more comfortable than the colored soft contact lenses. So I'm talking about the clear soft contact lenses. They're quite comfortable. Their design have sort of become very advanced over the years. And I mean, I work on soft contact lenses most days of the week, and I don't feel them. You don't feel them in your eyes anymore. So basically, as soon as we feel that the child is ready to handle the lenses by themselves, 8, 9, 10 years old, we can think about starting. Just a matter of sort of them put them in, take them out. That's it. We train them, we let them practice, and if they can do that, then they can wear the lenses. And the lenses that I mentioned, the MiSight is a daily disposable. So every day is a fresh new pair. There's no maintenance, there's no cleaning, there's no storing overnight. It's very convenient. It's very comfortable because it's a fresh new lens, and being a fresh new lens, the risk of infection is minimal.
Yeah, I remember, like, as an adult, when I started wearing contact lenses, I did have to get into the routine of cleaning them properly every night and storing them in the disinfectant every night. But then later I switched to daily disposables, and it's like I wouldn't go back. Just that's the ease and the convenience, and like you said, the hygiene benefits of just putting in a fresh pair of contact lenses every day and then throwing them in the garbage at the end of the day. It's just very easy, and I think it's probably something that would address some concerns that parents may have about whether or not their kids are going to be mature enough to handle the cleaning responsibilities. So with MiSight lenses, they don't need to worry about any of that, do they?
That's right. Yes. So it's very convenient.
Yeah.